Hello, welcome to Zoonosis with Joy. I'm Joy, and today we're going to be talking about advances in veterinary medicine and ways in which veterinary medicine can be even more advanced than human medicine. Now, we often think of human medicine as the cutting edge of medical science. They have a lot more resources, public interest, and scientists working on advancing the frontiers of diagnosis, treatment, and prevention of disease. However, in veterinary medicine, there are a few key areas in which there is greater advancement or more tools in our toolkit for helping these things. So I want to talk about 6 of them today. Leave a comment in the comment section below if you think of more or if you have any thoughts about that. Number 6 is the Lyme disease vaccine. In humans, the Lyme disease vaccine was discontinued in 2002 because there was a lack of public demand. However, since 2002, the incidence of Lyme disease has been increasing in Canada, the United States, and throughout the world. And there has been a renewed public interest in redeveloping a new vaccine for Lyme disease in humans. However, in animals, we've had the Lyme disease vaccine for years. It is actually a pretty well studied vaccine. It helps prevent the severe side effects associated with, or severe adverse effects associated with Lyme disease, and helps mount an immune response to that. So I think that one is maybe a little bit unfair because human medicine has already developed this vaccine. However, in veterinary medicine, we've actually maintained it because there's been a lot more demand in preventing these in dogs. In line with that, number 5, the isoxazoline class of anti-parasitic medications. So isoxazolines are kind of your standard flea tick and flea tick prevention. So these are things like you may have recognized some brands like NexGard, Simparica, Bravecto. I don't take any sponsorships and I never will, but these drugs and this class of medication are super helpful for preventing Lyme disease, but also preventing ectoparasite infections, Demodex, scabies, fleas, ticks, that kind of thing. Now, you may not think that these are important things for humans, but keep in mind that these medications can actually stop and prevent Lyme disease from even starting. It kills the ticks before they actually are able to regurgitate into the host, preventing Lyme disease at the start. Wouldn't you like to take a once-monthly medication during the tick season to never get Lyme disease or any other tick-borne disease? I would. That's why they're actually developing this medication for humans and studying it in a clinical trial right now. The problem with this medication is that the FDA has released a warning to pet owners that there is a risk, we don't know how risky it is, of potential seizure activity with this medication. So for now, we don't really know how safe it will be for human beings, but in the future, we could probably expect this to be seen more frequently. Number 4, I should say, is the pancreatitis-specific treatments. Pancreatitis is a very painful condition that is caused by inflammation of the pancreas. The pancreas is a secretory organ in our body that produces both hormones as well as digestive enzymes. And when it becomes inflamed due to many different reasons, it can cause anorexia and not wanting to eat, vomiting, abdominal pain, and in some cases can actually be fatal. So it's a very serious condition. And until recently, we've had very few tools in our toolkit for managing it. Most of the treatments have been supportive, including antiemetics, pain medication, as well as nutritional support and fluids. Pretty standards for any sort of gastrointestinal upset. And in human beings, that's still the primary standard of care. However, in 2018, they approved this injectable IV medication in Japan for the treatment of pancreatitis in dogs. It has been since conditionally approved in the United States and is on track to be conditionally approved in Canada. No such treatment is in the works as far as I know for humans. However, it may be developed in the future. And if it is, hooray! This is a very terrible disease, and I hope that we find very effective treatments for managing it. From what I understand, this medication basically prevents the extroversion of neutrophils into the pancreas, preventing the major inflammation and helping to treat those in those cases. So very cool stuff that's happening there. So number 3 this time, these would be our antipruritic medications. Now in human medicine, traditionally, the way that pruritus or itching caused by skin allergies like eczema, food allergies, that kind of thing has been treated, has been the use of antihistamine medications like Benadryl, Reactive, that kind of thing, which is diphenhydramine, cetirizine, HCl, that kind of thing, as well as your corticosteroid creams and pills, so steroids. So steroids and antihistamines, they have their uses. They can be quite helpful in that way. However, in dogs, we actually have not one, but 2 different antipruritic medications that aren't these kind of classes, that are far more effective and have far fewer side effects. That's Oclacitinib and the IL-31 monoclonal antibody. They basically, the Oclacitinib binds specifically to the itch receptor, the JAK kinase enzyme, and it helps prevent itching for like up to 24 hours. So it's very effective that way. The IL-31 monoclonal antibody is actually a monoclonal antibody therapy that binds specifically to the itch receptor for upwards of 4 to 6 weeks, in some cases 8 weeks. It's highly effective for dogs with atopic dermatitis, eczema. So this is something that's not available yet in human medicine, although as you'll see in the description, I'll post a link, there are a lot of medications that are being tested for humans right now. You may think, well, you could just tell the person to stop itching if they're really itchy. It turns out that if the person has, is a child or has mental disabilities or, is just suffering from really bad itching, having a medication on hand that can stop that feeling of itching is a game changer. And it's going to be really excited when this is available for human patients because allergies can really reduce their quality of life. And these medications have been very helpful. Of course, they come with side effects, as all medications do, but they, are on track to becoming one of our biggest medications that we have in veterinary medicine for treating these conditions. So that's number 3. So number 2, I've made a video about this in the past, but cloning. Cloning, somatic cell nuclear transfer, as you probably have guessed, has never actually been done successfully in human beings, primarily for ethics concerns, but also there's concerns about specific, doing this in primates and the risks and difficulties around that. Needless to say, we've been cloning animals for over 20 years now, almost 30 years now, I think. And it has been very successful. It is a very arduous and labor-intensive task, but it has actually gotten to the point where it is cheap enough for the commercial market, and people are cloning their own pets. If you want to see a video about that, you can check out this video here, and I talk a little bit more about cloning in animals. In humans, I don't think we're going to see that. We're not anywhere close to the actual clone wars, and I don't think I'm ever going to see cloned human beings in my lifetime. However, prove me wrong. I mean, what am I going to say? Oh, well, I'm wrong there. But regardless to say, cloning is becoming a much more important part of veterinary medicine than it will ever be in human medicine. Of course, there's huge benefits to this in terms of the agricultural productivity as well as helping owners clone their pets. So I feel like this is one that the veterinary medicine is really on the cutting edge. Some of the major researchers have been veterinarians in this field, so this is an area where there's a lot more. Number 1, and this may be a controversial number 1, is nutrition. Now, this is more keeping in line with the Hippocratic understanding of medicine of do no harm and dietary recommendations versus medicine, pharmaceuticals, those other kind of therapies. And if compared to human beings, we actually have a lot more tools in our toolkit available. This is a really important important class of things that can help manage patient conditions. Now, in human medicine, they can give you dietary recommendations. They can give you different kinds of foods that may be acceptable. They can give you, intensive care meal plans, that kind of thing. However, they don't really have any good complete meal replacements for humans, and those that have been put on the market have been dismal failures. In veterinary medicine, we can just pick a diet that is on label for the condition, tell the owner exactly how much to feed, and then manage a condition with no further medications. That is wild. This is something that just isn't around in human medicine. And having these prepackaged diets and multiple different vendors with high quality sort of ingredients, that can be really game changing. You can treat things anywhere from atopic dermatitis to urinary conditions to renal conditions to liver conditions, cancers. There's just a huge gamut of different things available. And I think this is an area where human medicine really needs to put more effort and knowledge in, because nutrition is the key to health, and it's one of those things that I think personally, I don't think it's given enough credit in human medicine. They don't learn about as much of nutrition in human medical schools compared to veterinary medical schools. So it's something that I think is something that is going to be important more so in the future, but right now veterinary medicine is leading the way. So that's kind of the video. If you have any other things that you think of, or if you have any comments about this video, of course leave them in the comment section below. I'm also taking ideas for future videos. I have a few of them on the back burner that I want to do in the future, but for now, that's all I have for today. Peace.